Welcome in. It is the local and community issues and answers right here with Jonathan Lawson. So thankful to have in the studio with us today Victoria Smith. She is from the Seton Home Health Center in Tri-County Hospice. Good to meet you, Victoria.
It's good to meet you as well.
And tell us, the viewing audience, about the Seton Home Health. What do you all do?
Well, Seton Home Health is actually a home health agency.
Okay.
We actually care for patients in the privacy of their home. It is a faith-based organization. We can provide nursing, personal care services, physical therapy, occupational therapy, speech therapy in the home.
Wonderful.
We actually, for our patients, have a nurse on call to them 24 hours a day. If they have any questions or concerns, they can actually contact a nurse 24 hours a day. And that is our home health side of our business. That is the Seton Home Health side. We also have Tri-County Hospice,
Okay.
which is our hospice business. And with hospice, we can provide a full hospice quality of care.
Right.
And it is a terminal diagnosis that brings a patient on service with hospice, but it does not have to be a cancer diagnosis.
Right.
So, and when they come on service with hospice, we very much believe that it's about living. It's not about dying.
Right.
And in that service, we can provide nursing, we can provide personal care services, we can even provide a chaplain.
Oh, that's wonderful.
If they don't have a minister of their own, we can provide a chaplain to them, or if they just feel that they need additional spiritual care.
So you all are helping so many people here in the community, people that's sick, people that needs, extra care. How many people you got on staff? Just different nurses and things like that?
We have right now about, on the home care side, I have about 6 visiting nurses, and I'm actually hiring additional ones.
Okay.
I have 5 therapists, 4 that are physical therapy and 1 occupational.
Right.
I actually have 2 speech therapists that are available to me, and that's on the home care side. I also have about 8 home health aides that are making visits to patients' home, and I even have a social worker who
Wonderful.
goes out and helps patients sometimes if they're having issues with trying to understand their bills or trying to figure out how to pay for certain services.
Right.
And then with hospice care, we actually have social workers that go out once a patient has passed and continue to provide bereavement to the family.
That's wonderful.
We have aides, we have 3 aides, and we have 4 visiting nurses at the present time.
Wonderful. So this is just reaching out to so many good folks around in our community. Where are you all based at? In London or Corbin?
We're actually based in London.
Okay.
For the home health, we actually cover Laurel and Pulaski counties. For hospice, we actually cover 4 counties.
4
we,
counties.
We cover Laurel, Whitley, Knox, and Clay for
Okay.
our hospice services.
And that means so much to the family because you're there for them, you're showing them compassion and care and encouragement, and that is just such a wonderful service. And like you said before, how can, if somebody is watching right now or listening and would like to be a part of this service, maybe even work for you, to help these folks, how can they do that?
Well, anyone can contact us regarding our services and find out whether or not they would qualify for those services by just simply calling us. Our phone number is 606-877-3950. If you're outside of the local calling area, we actually have a 1-800 number,
Okay.
and that's 1-800-224-2208. And we have someone manning that line 24 hours a day.
That is so wonderful. So this is such a great service, and you that's watching by the way of TV and listening by the way of radio, you need to support this service. What are some ways that the public and the people can help, maybe even refer people to you?
Anyone can actually make a referral to home health or hospice, and then what we do is we actually work with that patient and work with their physician to get the needed orders that we need in order to provide the care. And we will answer any questions anyone in the community has about whether or not their loved one would meet the criteria for services. And another way on the hospice side that the community can help us is that we need volunteers.
Exactly.
We need volunteers to work with the hospice program. We have a volunteer coordinator. Her name is Charlotte Blair, and she can help them with getting the needed training. And that's a wonderful program because those volunteers do simple things for patients. They may read to them, they may go grocery shopping, just the little things that sometimes are overwhelming for a caregiver.
And it means so much, and it means so much to the people, and once again, volunteers, what are the hours of operation?
For our services?
Yeah, for the services.
Well, the office itself is open 8 to 5 Monday through Friday, but we have staff who are working pretty much 24 hours a day.
Right.
Whatever the needs of the patient is what we're attempting to do.
Oh, that is so wonderful. And how about like in the home health, like when somebody comes to their home, how long is that?
Those visits are normally intermittent, and those are shorter visits, but whatever we're doing for that patient at that time, we're there until we get that taken care of.
Oh, that is
So if there's a need going on, if we need to call the physician while we're there, if we need to call another family member, explain the services of what we've done, we do that while we're at the home. And then we can follow up with the physician even once we leave the home. So it just depends on what care we're providing, how long the visit actually lasts.
Oh, that is phenomenal.